We are back here at Atlantic Health Systems, home of Atlantic Sports Health, with Adam Kahn, talking about concussion recovery protocols and research. Adam, you're going to talk to us about how fast we can start to exercise. And the research is starting to show within 48 hours of a concussion to get back to exercise. Tell us what the research is saying.
Exactly. So previously we talked about how the subsymptom threshold exercise protocol was used for difficult concussions, people that were having symptoms for a long period of time.
Mm-hmm.
But now, most recently, 2018 really was the premier study that came out. We're starting to see that you can exercise as early as 24 to 48 hours after the initial event. The protocol is still very similar, right? So somebody suffers a concussion, you give them a couple of days to feel a little bit better.
Sure.
But then ultimately you establish a safe heart rate where you can exercise them at and not exacerbate their symptoms. So you test them the first day. Once their symptoms exacerbate, you mark that heart rate down. You set up a protocol, 80% of that heart rate, where they get to exercise. Again, the benefits of exercise without putting them at risk for further damage in any way.
Wow, that's truly amazing. And, when you really think about doing the cardiovascular exercise to help facilitate healing of a concussion, it's really all about blood flow.
Yep.
Right? It's moving your blood around and getting fresh nutrients and oxygen to the brain, to the extremities, and mainly, obviously, to the brain. And I think, why wouldn't that work when you really think about it, right?
So you're 100% right. So ultimately, and this has been shown, the physiological effects of suffering a concussion, your autoregulators in the brain do not do a good job of keeping your blood pressure low, right, while you exercise. You want your blood pressure to raise everywhere else, but in the brain, it has to be controlled. And this is ultimately re-educating the brain to get back to its normal function like it was before. And it's been shown that not necessarily does it speed recovery up. There's some studies that have shown that, but that hasn't really played out completely.
Okay.
But it's shown that it decreases the risk of these becoming long-term symptoms type of concussions, meaning kids are getting better within 7 to 10 days, and at decreased risk of taking weeks and months to get healthy.
Makes perfect sense. And the fact that it's coming from you and Atlantic Sports Health, and it's being researched. And again, the risk factors of doing low-level cardio like this is very minimal, right? So it only should do good things for you. But great to know, great information. This is the place to be to see where you're at if you've ever been concussed or have any other sports ailment.